We'll go ahead and start with introductions. My name is Julie Aird. I am the Director of Student Affairs for the Sue and Bill Gross School of Nursing. And I just want to thank you for attending our very first DNP online information session today. And for our session today, we also have Dr. Suzanne Phillips with us, who is our interim director for the DNP program. Glad to have her with us today, and she's going to be going over a brief summary of the program, and I will be sharing information about admissions at the end. And in addition to that, we have Tina Nguyen with us, who is our academic counselor, and she's going to be monitoring the Q&A section. So if you have questions, feel free to type them into the Q&A section, and we will answer those at the end of the session. Okay, so I'm just going to get, okay, so this is our agenda for today's session. And first we will do a brief overview of our school, the Sue and Bill Gross School of Nursing. And then we will have an overview of the DNP program itself, as well as the curriculum for the DNP program. And then we'll go through the admission requirements, the application process, and frequently asked questions. And then we'll take your questions at the end. So we have a lot of information to give you, and let's get started. I'm going to hand the mic over now to Dr. Phillips.
Good morning. Welcome, everybody. We're excited to have you with us, and we're excited to talk about our new program. So for just a few minutes, I want to introduce our school. We are the Sue and Bill Gross School of Nursing at UC Irvine. The slide set here says our doors have been open for 10 years, and our School of Nursing has been in effect for since 2007. However, we have been training nurse practitioners here at UC Irvine since 1995. We were in the School of Medicine at the time as a postmaster's certificate program, and then once we had our school approved, we moved over to the School of Nursing. We currently have 16 regular faculty members. We'll say regular in that they are full-time. We have 9 tenure track faculty. Those are our researchers, and we have 7 full-time clinical faculty. Many of us teach the didactic content. Some are only in the clinic, and I'll go over that in just a little bit. We do have clinical instructors that help us out in clinical labs, in hospital placements for our undergraduate. We have without salary faculty who are faculty from other schools across the campus, community members, CNOs, those types of professionals, and we have adjunct faculty as well. We also have a large staff here that support the school. They are the members that keep this school running, and we couldn't do what we do without them. So you'll be hearing a lot from our staff members today, Julie and Tina, but you'll be involved with some of the other ones as you go through your admissions process as well. So our vision here at UC Irvine is to transform the nursing profession by preparing pioneers in research, education, and practice to build innovative interprofessional models of compassionate community-based healthcare. Since the opening of our program, we have focused on community-based care. We have a master's entry program that is focused entirely on community-based care, although they do get acute care training, as all nurses do. They do a lot of their clinical preceptorships in the community. Our nurse practitioner program that has been in existence since 1995, obviously our community placements. We're a family nurse practitioner program, so all of our students train either in our practices, our ambulatory practices here, or in the community and community health centers, which is the foundation of nurse practitioner practice. So although you have lots of choices for choosing a DNP program, why choose Irvine? Well, those of you that are not familiar with Irvine, we are located in the heart of Orange County along the coast, about 40 miles south of LA and about 90 miles north of San Diego. We recently, the city of Irvine was recently ranked the safest city in the country for the 8th consecutive year, so it's a wonderful place to come and study and also live. And the campus is just minutes from the ocean, from Newport Beach, just a short drive away, 5-10 minutes. We also recently had the announcement of our Susan and Henry Samuele's generous gift. They have provided $200 million to establish the Susan and Henry Samuele College of Health Sciences. The focus of this college is to focus on interdisciplinary integrative health, and the college is comprised of the School of Nursing, the School of Medicine, the Program in Public Health, and the Department of Pharmaceutical Sciences. Both of the latter programs will be schools very, very soon. The $200 million, the donation is to advance, obviously, research and education, as well as clinical practice for individual and population wellness, with a heavy focus on integrative health. We're very, very excited to be part of this school. You can see in the picture below, that's a rendering of our new College of Health Sciences, of which nursing will be housed in one of those buildings. So our current academic programs, we have a Bachelor of Science, we have a Master of Science, we have a Master's Entry program in nursing, and we have a PhD program. Our Bachelor of Science has nearly 350 graduates, currently 175 students, freshmen through seniors. Our freshman nurses do come in and declare as nursing majors as freshmen, unlike some of the Cal State systems and some of the private colleges which declare in their junior year. Our MSNP program, perhaps our oldest standing program, like I mentioned before, we have in our final Master's Family Nurse Practitioner concentration program, we have 14 students graduating this spring, and we have about 106 total graduates, some of which were adult gerontology primary care nurse practitioners. We did just welcome our first Master's Entry program in nursing last summer. They do have a summer start. These students have a bachelor's degree in a health-related field, and they will exit with a master's degree and an RN license. And then finally, our PhD program is growing. We currently have 12 students, and we have our first cohorts set to graduate this year. So I want to talk a little bit about the PhD versus DNP, because when you're considering a doctoral program, it is vital that you understand what you're getting into, because it requires an absolute commitment of time and resources on your part. In addition to the doctoral degree and the coursework that goes with that, you're choosing to come into a program that also has a nurse practitioner role focus, which adds many, many more courses that are leveled to the doctoral degree rather than the master's degree. So I wanted to go over just somewhat quickly the difference between a DNP program and a PhD program. We do have both here at UCI. Many of you may be familiar with this grid. This is a grid that was published by AACN, American Association of Colleges of Nursing. So the DNP, the graduate of a DNP program, the objective is to prepare nurse leaders at the highest level of nursing practice. The goal is to improve patient outcomes and translate research into practice in clinical practice. So the focus is to stay in the clinical arena, whether that is in a hospital setting, an ambulatory setting, a community care setting. The setting is not specific, but your goal is to stay focused in clinical practice and translate the research from the bench, if you will, to the clinical area. Versus a PhD, if you are considering a PhD, your career trajectory is to be an academic researcher, to work as faculty. DNPs also work as faculty, as I am one, but PhDs primarily work in research institutions, somewhat in the private sector, but for the most part in academic institutions, conducting primary research. Our students, like I mentioned, that with the DNP, you have a commitment to a practice career, and practice is defined fairly loosely. My DNP has a focus in health policy, so I am translating the health policy science into nursing practice, and in my specific case, into advanced practice nurses, versus a commitment to a research career. The program faculty that teach in the DNP versus the PhD, the faculty crossover. We do have PhD faculty teaching in the DNP, and I have taught in the PhD courses. You also will have master's prepared faculty teaching in the nurse practitioner concentration courses, because they are well prepared to teach that content. In terms of resources, all doctoral students have mentors and preceptorships in leadership and various positions. The PhD students, their preceptors primarily function in leadership settings, in research settings. Both have access to financial aid, and Julie will talk about that. And of course, both have access to information and technology resources for their area of study. So nothing is different in terms of what students have access to, whether you're a DNP student or a PhD student. One of the differences currently as it stands is DNP programs are accredited by a national accrediting body. So not only are we held to institutional standards and federal standards for university academic education for doctoral students, but we're also held to the nursing professions accrediting agency. PhD programs are not held to nursing accreditation bodies, but that actually may be changing in the near future. So there is lots of oversight for both programs, just a little bit different in terms of a practice doctorate. So in terms of understanding what it is that you may be getting into, the professional practice doctorate is designed to prepare nurse leaders. So you will obviously, coming into a dual program with a DNP and a nurse practitioner, we're going to teach you and you will graduate with competencies to be a family nurse practitioner in our program. But leadership is foundational, and you'll have to demonstrate that throughout the program. So obviously with a doctoral program comes pretty rigorous scholarly research and scholarly activities. As we go through the curriculum, I'll highlight some of those, but you will be writing a lot. You will be doing a lot of projects, a lot of group projects and individual projects, and you'll need to be ready for that in terms of understanding your statistics and being able to move from there. Obviously, we contribute to the growing body of knowledge in the nursing field, not by conducting original research, but by taking that research and translating it to the clinical setting. So the next 3 slides are a little bit wordy. I'll leave you to read those on your own, but I do want to highlight we do have 12 program learning outcomes. That is a rigorous. The outcomes are rigorous, and what you have to do to demonstrate competency with each of these outcomes it takes a lot of work. So I do not want you to underestimate by choosing to come to a DNP nurse practitioner program that it'll just be pretty much a master's program, and then we have a couple of extra courses. We will hold each student responsible at the end of the program for all of these program learning outcomes through a professional portfolio and a scholarly project. So obviously in this first slide you see quite a bit about clinical judgment, integrating nursing science and science-based theory, systems practice, or systems knowledge. We'll talk about that, and as I go, these will become more apparent as I go through the curriculum. Of course, communication skills will be covering a lot of quality improvement and safety initiatives. If you're a registered nurse functioning in a hospital at this time, this is very much a big topic, and you're probably doing a lot of research in this area. Critical appraisal of the literature. If it's been a while since you've had an undergraduate research course, you will have an opportunity to have a graduate level introductory research course, and then there'll be 2 additional research courses on top of that. Dissemination of your data or of your project, you'll have an opportunity to do that by the end of our program. Many DNP students go on to publish their projects, and as the DNP degree has developed over time, there are specific settings and specific journals that focus directly on DNP projects versus original research publication. You will have an opportunity to convene and lead interprofessional collaborative teams. Many of you are doing that now as registered nurses, so we'll take that to the next level as we expect DNPs to be the leader of most of these teams in the future. And of course, we have a fairly heavy impact on health policy, both at the local, the national, and the global level. We can't, DNP programs are not complete without understanding the business aspect of healthcare, resource efficiency, quality. Many of you will come in with management experience, and so you'll have a little bit of this. Some of you may come in with an MBA and have more of a background in this area. Some of it will be very new to some of you. We'll talk about nursing advocacy. That is not new to registered nurses, but in terms of your role as a doctorally prepared nurse will be significantly greater. And then finally, synthesizing data from research, practice evidence, and other credible resources. All of these objectives will be measured through the end of the program, and we'll talk more about that as I get through the curriculum. So to discuss the program in general, our DNP program is considered hybrid. It has a hybrid delivery platform, which means we have online and limited on-site requirements. So you will be required to come to UC Irvine. We have found that there certainly are traditional programs where everything is on-site, and there certainly are programs that are all online. And we believe that having students come together and working together outside of the virtual environment is critical, especially when we're learning to develop and lead collaborative teams. So we have developed 2 tracks, track 1 and track 2. For this fall, we will be accepting only track 1 applicants, and these are for students that have a bachelor's or master's degree in nursing who are also seeking a family nurse practitioner certification. This is completed in 11 quarters. In the future, and I'm not able to tell you if this will be next year or the year after that, we will be implementing track 2. This is where students come in with a master's degree in nursing, seeking the DNP degree without nurse practitioner certification, and that's completed in 7 quarters. So our program has been designed in a unique way. Certainly you have lots of choices when it comes to DNP programs. You have traditional, you have hybrid, you have online. What's unique about our program is our philosophical core. We're committed to holistic, ecological approach to understanding the individual, the family, and the community. We have chosen to start the DNP with the family nurse practitioner concentration because we believe the family is central and important, and however family is defined is important in keeping people healthy. So we've decided to start with the family, and you will have significant interaction with community. Our unifying vision, promoting community and population health through the development of new models of transitional care. Some of you as registered nurse may have been involved in the early beginnings of transition care from hospital to the community. Our students will be developing and implementing some of those models. We are at the beginning of our interdisciplinary education journey. We are fortunate that we have 3 other colleges in which we can collaborate to bring opportunities for you to learn together. We certainly have those opportunities now in our current programs. Our bachelor's and our master's students do meet with the medical students, and in many cases public health students as well, both in the didactic setting and clinical settings and in community events where they all come together and provide care to the community. And we have expert clinical and research faculty. The Sue and Bill Gross School of Nursing faculty practice began a couple of years ago. I'm the chair of the faculty practice, where we have 7 nurse practitioners providing care in our institution, whether it's in our same-day clinic, our FQHCs, or our student health. And students will have the opportunity to complete clinical practicum, nurse practitioner practicum with us in those settings. We also have expert research faculty to support doctoral level scholarships. So when it comes to the research and to understanding the statistics and to translating some of that, we have experts in that area, and many of our courses we will have both a DNP and PhD faculty to help with that component. So I'll get into the curriculum at this time. The curriculum is separated out by year. So I'll go from year 1 to year 3. Again, track 1 is covered over 3 years. Track 2 is covered over 2 years. So I'll be talking about track 1 today. You can see on the screen there, we have the background is in white, in green, and in purple. The courses that have a white background are considered DNP core courses. Those are the courses that all DNP students will take regardless of track. The APR Enroll courses are courses that for all of you, you will be seeking the nurse practitioner concentration, so you will be taking those. But if we have DNP only students next year, they will not be taking the ones in green. So for the first year in fall, we would start with an on-site 20-hour DNP prologue that would be combined with an orientation. So there would be additional hours of orientation, which we'll talk about in a little bit. That will be on-site where you will meet your faculty, you'll meet your cohort. We'll spend quite a bit of time talking about the program, understanding how to begin your research. Your orientation will comprise our IT specialists and our instructional designers, so you understand how to use our online platform. And we'll begin to talk about projects that you may be interested in. That year, you will have a hybrid course called Leadership and Professional Collaboration in Healthcare. That's what we call a 3+1, so it's 3 units of didactic plus 1 unit of practicum. You will have an off-site leadership and collaboration practicum that will be required. That'll be 30 hours of practicum experience. The next course is 200. It's Research Methods. This is a beginning graduate research course. For those of you that come in with a master's degree already but do not have the nurse practitioner concentration, it is possible that this course would be waived because you likely had that in your master's program, but we'll be evaluating your applications for that. And then there'll be an elective, curricular design for the health professions. We have 2 electives that will prepare you to be nurse educators. We have a new faculty member who has an EDD, and she will be leading these courses. You can see winter has an online course, Appraisal and Translation of Evidence for Practice. That is the second of the research series. You have another 3+1, a Health Politics and Policy course, or you'll have an additional 30 hours of practicum to complete in that as well. And then finally, your Health Promotion Disease Prevention, which is a 3-hour hybrid course. You can see spring, you'll have the third of your 3 research courses at the top there, 222A. You'll have Social Determinants of Health, and you'll have Advanced Pathophysiology, which is an online course. Second year will include summer quarter, so you'll see you'll be going through all 4 quarters. Foundations of Health Systems and Health Economics and the Science of Change, Quality Improvement, and Program Evaluation are in your summer quarter. Then we move into, we get pretty heavy into the nurse practitioner concentration courses. You can see all of those that have the green background there, Health Assessment and Health Assessment Lab, Advanced Pharmacology, Compassionate Care of Underserved Populations, which is our Vulnerable Populations course. You'll move to our second pharmacology course. You'll have Primary Care of Adult Geriatric Acute Common Conditions and your Primary Care of Women's Health. It'll be in the winter quarter of your second year where you'll begin your DNP Advanced Practice practicum. In the spring quarter, you'll start the first scholarly project course. This is where you will begin planning for that DNP project. Previous to this, as you move along in the DNP core courses, you will be thinking about your project and what you want to focus on, hopefully in those courses, and we'll talk about this in the prologue. You'll be beginning to collect your research and your evidence for the project that you'll be embarking on. You'll also have a procedures course in that quarter. Some of that will be on site where you come in and you do those procedures here and with faculty, pediatrics, and then you'll move into chronic conditions. You'll also have a practicum at that time as well. And then finally in year 3, we have the DNP intersession. That will be a 2 2.5-day, 20-hour on-site intensive. You'll also have primary care OB, which is an online course. Frameworks for Advanced Practice Registered Nursing Role, which is basically all of the professional issues that nurse practitioners will encounter. And you will be in clinical practice, practicum at that time as well. And then as we get into that third year for fall, winter, and spring, you can see that you'll be primarily working on your clinical practicum hours and your scholarly projects. So that will leave those quarters open to focus on the final project and your presentation at the end of the spring quarter in the DNP epilogue. So in terms of our teaching tools, our learning platform is Canvas. Some of you may have used this system before. It is not unlike other online learning platforms out there, but of course they all have their differences. We are fortunate to have an instructional design team and an IT specialist that understand this system very well. The instructional designers are full-time and they will support your online learning needs. We also have technical support 24/7 for the Canvas system needs itself. You can't get a hold of faculty 24/7, but certainly the technical support is there for you. In terms of our program, our desire is to maximize that student interaction. All the faculty that have DNP here, that have a DNP degree here, we've all been to some different programs, and we're pretty solid in maintaining the student interaction piece. That can be done online, and it can be done online well, but it does not substitute for direct interaction for the on-site days. So we will have an orientation in the fall of year one. We have not completely mapped that out, so that'll be planned for 1 to 2 days. It'll be in combination with your first on-site intensive, which will be 2.5 days. So that DNP prologue will be 2.5 days. That will be the most time that you will spend on campus that quarter. The DNP prologue for track 1 and 2 is in fall of year 1. The intersession for track 1 is in summer of year 3, summer of year 2 for your track 2s, and the DNP epilogue is in spring of year 3 for you. Our hybrid courses, and when you take a look at the curriculum more closely, you'll see an H, an O, or an S. If it's an H, courses are marked as an H. They do have an on-site requirement and or an off-site practicum component that will be described when you're here for orientation. If it is strictly a hybrid course, you'll have 1 to 2 days on-site at the end of the quarter, depending on how many courses that are hybrid for that particular quarter. Throughout the quarter, you will have synchronous and asynchronous online learning opportunities where you will do presentations, you'll present, you'll discuss. It'll be very robust. For your practicum, you'll have both on-site and off-site practicum experiences. For your NP role courses, we will bring you on-site to assess your skills. So physical assessment, procedures, those types of things will require on-site demonstration. Will require on-site demonstration of those. So you may have an online learning component throughout the quarter, but then at the end you will be asked to come in and perform either an advanced physical assessment or certain procedures, those types of things. Track 1 students will have off-site practicum experiences for your nurse practitioner role. So those are just the traditional clinical courses where you're assigned to a preceptor. You'll go and work with that preceptor 1, 2, 3 days a week, depending on how many hours you need to complete for that quarter. And that they will be assessed by faculty. Track 1 students will be doing their nurse practitioner role practicum in California only, which is why you must have a California license. There are some courses, like I mentioned before, that have a practicum component that are didactic. So I'll take the health policy course, for instance. If you live elsewhere in the United States, you will be able to do the 30 hours of practicum within your state. We will still need to have affiliation agreements with those areas, but you will not be doing clinical learning, but really rather experiential learning in that topic, whether it's leadership, health policy, systems management, business, and the like. If you see a course marked with an O, that's an online-only course. There will be synchronous and asynchronous online learning opportunities, and you will not be asked to come in for those courses marked with an O.
Okay.
All right, so I'm going to turn this over now to Julie, the Director of Student Affairs, who will talk a little bit about admission.
Great. Thank you, Susie, for all that wonderful information. And it's great to hear that description of the course in depth. So we are on a fairly tight timeline this year for admission purposes. As you may know, this is our first cohort we are admitting for, and we have been patiently waiting for all of our final approvals to go through. So now we can open applications, and they are already open, and they are due on May 15th. And at that time, we're going to request that all application materials be submitted by that time. As we've already mentioned, as Susie's already mentioned, we have two tracks in this program. The first is for students that have a bachelor's or master's degree in nursing from an accredited program, and also have an active unrestricted California license. Track 2 is for students who have a master's degree already in nursing and have an active license in another state or in California, but this program does not include the nurse practitioner certification. So for for the fall of 2018, we are only going to be accepting applications for track 1. All applicants must have at least a 1 year of full-time work as a registered nurse in the U.S. prior to the start of program entry. And that means prior to our September start. So if you graduated from a bachelor's in nursing program last year, you may still be eligible if you have a year of work experience by our fall start time. We also require that you've completed a course in descriptive and inferential statistics. That's basically an undergraduate introductory statistics class, and you must have had a B or better in that class and have it within the last 5 years. So if that is not something that you have at this time, it can be taken this summer prior to the fall start. So the application instructions are as follows. You must submit an online application for graduate admission. On our website is the same information, and those links are active and will take you directly to our graduate division application, where you will select the DNP program. In that application, you'll be required to complete a personal history statement and a statement of purpose. Each of these are up to 1,200 words each. And we have specific guidelines on our website for the content that we want you to have in each of these sections. So please be sure to check our personal history and statement of purpose guidelines on our website. For international applicants, you will not see the personal history section in the application. So we ask that you complete the statement of purpose essay in the application, and then that you would email your personal history essay to GNSAO. And again, both sections can be up to 1,200 words. Lastly, we will require a copy of official transcripts from all colleges and universities attended. And this is not just schools where you have received a degree, but every school that you've ever attended post high school. In addition, we will require 3 letters of recommendation, and we'd like one of those to be from a recent employer, a clinical employer, one from a college professor or an instructor who can assess your readiness for doctoral studies, so an academic recommendation. And then the third recommendation can either be from an employer or an academic person. The recommendations should be current. And in fact, they cannot be written with over 3 years from the time of the application. So if the recommendation, for example, was written a year ago, that is something that you can still submit to us. We will not consider additional letters of recommendation beyond the 3 letters. And friends or family members are not allowed or eligible to write letters of recommendation. There are instructions for submitting the letters of recommendation on our website, and those are actually easily processed through the online application. So the recommenders are actually sent a link where they can send their recommendation and their letters and upload them all online. There is the option of sending hard copies to our office also, but most people choose to do an online submission for their letters. Lastly, we're going to be requiring a resume or CV that details your educational background, professional work, clinical experience, your professional and or community activities, your certification and licenses, as well as your awards, honors, and merit scholarships, any bilingual abilities you have, and any unique experience you think is relevant, including to but not limited to presentations, publications, leadership, and research. So please take special attention to make sure that this resume is detailed and includes all of these factors here, because these are going to be important components in the application review. Then you need to mail or hand deliver the following items in one packet to our office by the May 15th deadline. And we do ask that if at all possible, please submit everything together in one packet. So that would include all of your transcripts from all the colleges you've attended, as well as your resume. And again, your letters of recommendation can be submitted online, but if that's not a possibility, then those would be included in this packet as well. And you'll send it directly to our Burke Hall address, attention the DNP application. And as a reminder, the GRE is not required for this program, but we will be interviewing candidates for final selection. The fees for this program are $9,000 per quarter. So in track 1, because it's 11 quarters, the total fees for the 3-year program will be $99,000. In track 2, when that comes available, since that's 7 quarters, that will be $63,000. And this program will be a self-supporting program. And again, it's a 3-year program for track 1, 2-year program for track 2. And UCI will bill you each quarter. Now, these figures may not be final. The actual tuition fees and charges are subject to change, both before students enroll and during the students' enrollment. The program fees do not include fees and expenses such as mandatory health insurance fees or compulsory campus-based fees or other miscellaneous fees to include books, supplies, or course materials, or room or living expenses or transportation services. So those fees are all covered by the student. And because the Doctor of Nursing Practice program is a self-supporting graduate program, certain fee waivers traditionally accepted by the University of California will not be accepted. For example, CalVet waivers or UCI Medical Center employee reduction programs, for example. If you have further questions about this, please feel free to contact our office, and our direct email address is gnsao, that stands for Graduate Nursing Student Affairs Office, at uci.edu. So there is assistance available, and students apply for graduate assistance in the normal way that they apply for other graduate programs with the FAFSA, and this makes students eligible for need-based loans. Students will also be eligible for internal need-based grants, and we will be taking 8% of our annual revenue and returning that back to students in the form of financial need-based awards. Lastly, for UCI Medical Center nurses, we will be providing a 10% discount on their entire fees. You may have noticed in many publications that the FAFSA is due March 2nd. However, this year we will be accepting financial aid applications through May 15th. So please be sure to complete a FAFSA by May 15th so that you can be eligible for all of this need-based scholarships and awards. We also encourage you to look at outside external scholarships, and there is a link on the financial aid website. If you go to UCI's financial aid website and you search for the external scholarship database, there is a sublisting there for scholarships available for nursing graduate and undergraduate students. So we definitely encourage you to check that out as well. So let's go over some frequently asked questions. What can you do after completing the DNP? Well, DNP graduates will serve in advanced clinical and leadership roles, including professional education, teaching, and interprofessional collaboration. Are there research opportunities in this program? So, as Susie mentioned, one of the differences between the DNP and the PhD is that the PhD focuses more on original research, and the DNP focuses more on taking existing research and translating that into clinical practice. So each DNP student will have a scholarly project in which the students, it will offer the student the opportunity to research, implement, and evaluate a clinical practice or health policy issue. Can you work full-time while in the DNP program? Well, full-time work is possible. However, we don't recommend it because the DNP is a full-time program and the pace and intensity are demanding. And Susie's looking at me. She'd like to comment on this, so go ahead, Susie.
Sure. In terms of working full-time, ask yourself, if you were applying to a PhD program, would you work full-time during a PhD program? Not only do you have doctoral work, but you have 1,000 hours of clinical work that has to be completed within that three-year time period. So it does get very difficult to balance all of that.
Yeah. Thank you for that. Okay, some of you might be wondering, are any of my courses, can I transfer any courses if I have a master's degree? At UCI, we do not accept transfer credit for doctoral programs. But if equivalent courses were taken at another graduate nursing program, up to 3 courses can be waived. However, the units would still need to be made up by taking elective courses. So we do have some electives available that you can take if you've already completed some content in other courses at other universities. But again, up to 3 courses max. And as I mentioned earlier, health insurance is not included in the fees. We did that intentionally when we set up the program because we were confident that most of the applicants would already have health insurance through their employer, and so we didn't want to add additional fees to the program for that. And as I also mentioned, that this program is not eligible for UC employee tuition and fee reduction program through the University of California, but the program itself is going to be offering 10% discount to all UCI Medical Center employees on the fees. For admissions, the question often comes up about letters of recommendation. Does one have to be from a faculty member? Because sometimes people haven't been in school for a while, so they're curious about that. But we really do want one letter from a college professor or instructor who can assess your readiness for doctoral studies. If this can't be obtained, then we would like a letter from an individual who can assess your academic performance. So that is really important, that that there be someone who can attest to your readiness for graduate work and your ability to be successful in a doctoral program. If your statistics course is over 5 years, then you'll need to take that course sometime this summer prior to fall entry. Can I submit my transcripts electronically? Yes, we do accept electronic transcripts, and they can be sent directly to gnsao at uci.edu. And again, these must be sent officially from the institution, but many institutions offer an electronic option, and so we do accept those. How many spots per cohort? For this fall 2018 cohort, we have 30 spots available for track 1. And again, track 2 will not be available in fall 2018. We will be notifying applicants of admission by the end of July. And we also have a link here if you want to visit the campus. Are there any recommended hotels, for example, or these would also be possibilities for you when you come for your intensives. So we've got a link there for local hotel information, and that is www.studentcenter.uci.edu/visitor center. Now, as far as your clinical requirements, we get the question, do you have to find your own clinical preceptors? Well, track 1 students are going to be required to complete their DNP practicum with preceptors who have been vetted and approved by UCI DNP faculty. So students can recommend preceptors who they have worked with, and UCI will also coordinate preceptors as part of the practicum assignment. And your clinical hours will begin in year 2. Susie would like to comment.
I just want to add to that. I mentioned previously that some of your didactic courses will have practicum requirements such as health policy or leadership. The 30 hours of practicum that is required for those courses can be completed if you reside outside of California. Again, because it's not direct patient care. These are leadership practicum, policy practicum experiences. So those can be done outside of California. Those begin the first year with those first courses. So any course that you see that has a 3+1 or a 2+1, that +1 is 30 hours of practicum, but not patient-based practicum.
Okay. And finally, we listed our website here. Hopefully you guys have all checked this out by now because you registered for this webinar, but just to remind you, our website is www.nursing.uci.edu/DNP. Our email address is gnsao@uci.edu, and our physical address is 105 Burke Hall in Irvine, California. And our phone number is also listed there. I also want to let you all know that we are recording this webinar session, and we will be posting this on our website. So you can feel free to listen to this again and come back to it. And specifically, if you want more details on those online versus hybrid courses and you want to review those curriculum slides again, you'll be able to do that. So now we would like to turn it over to you, and we thank you for the questions that you've been submitting. And this is the time, if you have any questions that haven't been answered, to go ahead and let us know. So I'm going to ask Tina, our advisor, to facilitate these questions for us.
Okay.
So whenever you're ready, Tina.
All right, thank you so much. So there are a couple of questions. Susie, can you talk a little bit more about the 10-20 hours required on the high, average, or low end of average DNP program?
All DNP programs in the country require 1,000 hours. So we have 1,020 because 720 of those hours are direct clinical care. The balance is contained within those didactic courses. So all programs in the country do require 1,000 hours.
Okay, so are we only planning on accepting FNPs for the DNP program?
For this year, yes, we have a family nurse practitioner concentration. Other nurse practitioner concentrations such as acute adult gero acute care, pediatrics primary care, pediatrics acute care, and so forth. We do not have those programs at this time. We'll be looking to open additional tracks as soon as we have this cohort through.
And do you accept international students for the DNP application?
Yes, we do. We do accept international students. However, they must have a California license.
California nursing license.
Yes.
Okay.
So the next question is, early in the seminar, we mentioned that 3 other schools will be in collaboration with the interdisciplinary education. Which schools? Those schools include the School of Medicine, the School of Pharmaceutical Sciences, and the School of Public Health. We do have educational experiences where we work with each of those, and those will be growing as this program grows. As our chancellor has and our vice chancellor have a commitment to ensuring that UCI begins to build and maintain interdisciplinary education.
Okay. Are there any additional questions, Tina? Any additional questions?
A few more minutes, yeah.
From anyone out there? We'll wait another few minutes or a few seconds. Well, if there are no other questions, we want to thank you. Oh, here come a couple questions. Hold on. And so the follow-up question, I think, to that, Susie.
So the follow-up question, are they all UCI schools? Yes, they are the School of Medicine, the School of Pharmaceutical Sciences, and the School of Public Health. Those are all UC Irvine programs.
Okay. So is a DNP required to become an FNP, or can a master's degree be acceptable?
So at this time, a master's or a DNP is required to be a nurse practitioner regardless of specialty or regardless of concentration. There is no state legislation that requires a DNP in any state at this time.
Okay, so this particular person has a California registered license, but will be moving to California from Washington. So will I be admitted, and will I have to pay an additional fee to the $9,000 quarterly fee? So is that in regards to the out-of-state tuition?
No, the fees are the same for every student regardless of what state they reside in.
Okay. So how likely are you to accept a student who has not had any research experience?
Because this isn't a PhD program, formal research experience is not required. We simply ask that you have, as part of your undergrad nursing program, you will have had an undergrad research course. If you come in with a master's degree, you will have had at least one course in graduate level course in research, but we will provide the research courses for you.
And the main thing is that when it comes to full-time work experience, you need to have a minimum of 1 year full-time before being admitted into the program. Okay.
Yes.
So the next question, I am a Tennessee registered nurse, so I am in the process of applying for a California endorsement. What if the endorsement is not completely processed by May 15th? So that is fine as well too, as long as you are completely endorsed by the time that you are admitted into, or the start of the program,
right,
which is September 27th, 26th, I believe.
Yeah.
Good questions. Okay. I think I see something.
Any additional questions?
So when will track 2 open? Do we have a projection of that?
Likely next year.
Okay. Since this is a new program, what international opportunities will there be for DNP students? And do you think it is feasible with the intensive curriculum of the DNP program?
If you're referring to international mission work, those types of things, our nurse practitioner students have been engaged in international work for some time. They've done it outside of UCI. we have not had faculty that, in the past, we've not had faculty that have been able to explore international types of programs, summer or otherwise, but we do have faculty now, so that will be discussed and looked at as the program evolves.
Okay, on the courses marked with an O, they will be online and we will not be asked to come in for those courses. Should we live nearby? Is it possible to attend the lectures in person?
So the answer to that question is no. It's an online platform, so there will be no formal lectures. All of the content will be online. For those of you that have been in online programs before, some of you have not, the online platform is not a lecture sort of discussion type of platform. It's more experiential learning. There is some small amount of lecture, but it really is about the activities.
So what does the FNP certification entail? Is it an exam or a dissertation project?
So the question you're asking is actually two-part. The DNP degree, the Doctor of Nursing Practice degree, requires the completion of a scholarly project and a professional portfolio that you acquire over the course of the program. When you graduate from the DNP Family Nurse Practitioner concentration, you will be eligible for state certification as a nurse practitioner in the state of California and eligible for national board certification as a family nurse practitioner. So it's two separate things. You have a DNP degree, you have a nurse practitioner role.
So will all applicants be required to interview? And if so, what is the tentative window for being selected for the interview? And will the interviews be completed and all notices sent regarding accepting by July 31st?
Yes, so our top applicants will be invited to come for interviews, and we intend to schedule those interviews for the latter part of June, and then all offers and denials will be sent out by the end of July.
The next question, how are presentations presented during synchronous education? So if you have an online course or a hybrid course, there will be synchronous times when all students must come together at the same time. That will be outlined during the prologue, and all students will be signed in. That you will have to have a computer with a camera, and presentations will be given in that manner.
Okay. So what is the difference between a DNP and an MSN degree if both are eligible for the FNP certification?
The difference between a DNP and a master's degree is a DNP is doctoral level education. At this time, both master's and DNP are accepted for national certification and to practice in every state. But the American Association of Colleges of Nursing have called for the DNP to be the terminal degree for nurse practitioners and all other advanced practice nurses. Although the nurse practitioner community nationally has not mandated that in terms of the certification bodies are still allowing you to sit for the exam with a master's degree, other advanced practice specialties have. So for example, the nurse anesthesia community, you will not be able to find a program that is not a DNP program after 2022. The clinical nurse specialist advanced practice programs will be all DNP by 2025. So in terms of the difference of degree is the difference between a master's and a doctoral degree, and that's the level of education and the amount of coursework you have to do.
All right.
Okay, I don't see any additional questions. This is the last call for questions. And thank you everyone for attending, and we so look forward to receiving your applications. Feel free to contact us at this contact information with any additional questions. And again, we will be recording this session and you can listen to it at any time if you'd like to hear any portion of it again.
All right.
Thank you very much.